I'm Jody Coombs. I'm the Chief Operating Officer. The top priorities that we really have right now for the organization as we go through this COVID journey is really three things. One is our workforce, the health of our workforce. How are they doing both mentally and physically? We know that this is a really hard time because not only are they worried about the patients that they're caring for, their colleagues, but also their family and friends. And we've really put a lot of effort in trying to think about how we can think about wellness during this time that's stressful for our entire organization. And under the leadership of Jen Bickle and a big team, they've really come together to look at ways to provide respite, to provide support. And in fact, when we start our meetings, our daily meetings every day, we actually have a 10-minute mindful moment in which we personally try as leaders to clear our brains and to ground ourselves so that as we're making decisions and as we're thinking through this ever-changing landscape, that we have a fresh mind to do that with, so that we're making the best decisions and that we're working the best that we can together. The second thing that's important to us is really looking at our PPE and making sure that we have the right amount to provide for our frontline workers and for all those who are in our hospital. Because we don't know the amount of supplies that we're getting in, we have to monitor our PPE usage daily and sometimes multiple times a day. There's a group of leaders, clinicians, nurses, doctors, respiratory therapists that meet every day to look at the amount of PPE we have and do we have enough to provide the care today. We want to make sure that we're putting everybody in a safe position to care for patients, especially with this new COVID virus. The third priority we have is really looking at our clinical care and our models of care. We know that they've changed drastically. We knew that when we had to reduce the amount of people in a room caring for a patient, that was going to change how we delivered care. Every day we're asking ourselves in this team, how are we providing care? Do we feel good about it? Do we know that we are providing good, safe, sound care? That is job number one. No matter what happens, no matter what changes from day to day, minute to minute, the top thing that we're focused on is making sure that we're delivering safe care and that we're also keeping our employees safe during this time. I just want to close thanking every member of the Children's Mercy team. It takes a village. It takes every single person coming together and figuring this out. And I know that we are going to be stronger as a team as a result of this. Thank you so much for all that you do.